Good day to everyone. This is Kimberly Ann in Quezon presenting to you the drug furosemide Lasix. Furosemide is an antihypertensive loop diuretic water pill. It prevents the body from absorbing too much salt. This allows the salt to instead be passed in the urine. Lasix is used to treat fluid retention or edema in people with congestive heart failure, liver disease, or a kidney disorder such as nephrotic syndrome. Lasix is also used to treat high blood pressure or hypertension either alone or in combination with other antihypertensives. In relation to the case, Mr. Case has been recently diagnosed with hypertension. Therefore, furosemide will help him manage mild to moderate hypertension as adjunct to treat acute pulmonary edema and hypertensive crisis. Let us now proceed with the mechanism of action. Furosemide inhibits sodium and water reabsorption in the loop of Henle and increases urine formation. As the body's plasma volume decreases, aldosterone production increases, which promotes sodium reabsorption and the loss of potassium and hydrogen ions. Furosemide also increases the excretion of calcium, magnesium, bicarbonate, ammonium, and phosphate. By reducing intracellular and extracellular fluid volume, the drug reduces blood pressure and decreases cardiac output. Over time, cardiac output returns to normal. Some of the adverse effects of the drug are hypokalemia, hyponatremia, and dehydration, because vigorous diuresis may lead to profound water loss depletion. Sudden volume depletion may also result in increased risk of thrombosis, circulatory collapse, and sudden death. Acute hypotensive episodes may occur sometimes several days after beginning the therapy. Ototoxicity, deafness, vertigo, and tinnitus may occur especially in patients with severe renal impairment. Now, what are the nursing responsibilities? Baseline assessment. It is important to check and monitor vital signs, especially blood pressure and pulse for hypotension before administration. Assess baseline serum electrolytes, especially for hypokalemia. Assess skin turgor mucous membranes for hydration status and observe for edema. What else? Assess muscle strength and mental status. Note skin temperature and moisture. Obtain baseline weight and initiate I&O monitoring. Intervention evaluation. As I have said, monitor blood pressure, vital signs, blood glucose, serum electrolytes, uric acid levels, I&O, and weight. Note extent of diuresis. Watch for symptoms of electrolyte imbalance. Hypokalemia may result in changes in muscle strength, tremor, muscle cramps, altered mental status, and cardiac arrhythmias. Hyponatremia, on the other hand, may result in confusion, thirst, and cold, clammy skin. We also need to provide safety of the client by raising the side rails of the bed. Give heart candies for nausea. Patient family teaching. Tell the patient to expect increased frequency and volume of urination. Tell the patient to report palpitations, signs of electrolyte imbalances, and hearing abnormalities such as sense of fullness in ears and tinnitus. Instruct also the patient or family member to take the last dose of furosemide several hours before bedtime to avoid sleep interruption from diuresis. Or better, take the dose in the morning. Additional health teaching is to advise patient to change positions slowly to minimize effects of orthostatic hypotension and to take furosemide with food or milk to reduce GI distress. Caution patient about drinking alcoholic beverages, standing for prolonged periods, and exercising in hot weather, because these actions increase the hypotensive effect of furosemide. Also, emphasize the importance of weight and diet control, especially limiting sodium intake. Unless contraindicated, urge patient to eat more high-potassium foods such as whole grains, legumes, meat, bananas, orange juice, potatoes, and raisins. Also, avoid sunlight and sun lamps. For the EBP, this is the study conducted by Espinoza, Al-Khatib, and Sadiki 2021, wherein the efficacy of bolus intravenous therapy versus continuous infusion of furosemide in acute decompensated states was evaluated in the DOSE trial. The DOSE trial demonstrated that in patients with decompensated heart failure, there was no significant change in patients' global assessment of symptoms or change in creatinine level when an IV bolus versus continuous infusion of furosemide was used. Patients in high-dose continuous infusion therapy did achieve greater diuresis, an improvement in secondary measures such as net fluid loss, change in weight and area under the curve for dyspnea at 72 hours, but also had temporary worsening of diurnal function. That is all, and thank you for listening.